Hello, my name's Abby Petterson, and the profession I chose to research was registered nursing. Registered nurses work alongside doctors, therapists, social workers, and others to provide medical care to patients who are sick and injured while also ensuring the comfort and care of the patients. Nurses provide preoperative and postoperative care, work with patient records, and schedule needed treatments. Nurses can conduct physical exams and perform vitals such as temperature, respiration, blood pressure, and pulse. They can administer medication and fluids through an IV and conduct blood work and other similar tasks. They monitor patients' vitals and communicate to the doctors, patients, and patients' families, as well as providing emotional support for the patients and their families. They can stay up to date on current medications, current treatments, and current healthcare options. During your high school years, it's important to maintain a 3.5 GPA or higher. It's also important to take classes such as anatomy and physiology, sociology, psychology, biology, and high levels of chemistry, while also taking a foreign language. Finding opportunities such as job shadowing at hospitals near you or doing things like HOSA is good to get you ahead for nursing school. Going to career fairs helps to find colleges that are best suited for you. During post-secondary education, nursing students have two options. Number one, they can complete a program for their ASN, Associate's Degree in Science of Nursing, which can be completed at a community college. They can then go on to take their nursing exam given out by the NCLEX and then become a registered nurse, or they can choose to take a 4-year college program at a college or university for their BSN, Bachelor's Degree in Science of Nursing. RN to BSN programs are accelerated and can be completed in 3 years or less. When you think of nurses, you think of hospitals. Nurses work on hospital floors such as oncology, the ICU, the CCU, the NICU, the PICU, and the ER. But nurses also work in prisons, schools, and outpatient facilities. Nurses can travel around the world from hospital to hospital, or they can travel to patients' homes to ensure medical care to patients who cannot get to hospitals. I chose nursing as my job of choice for multiple reasons. The thought of helping people as my job interests me. I'm a very caring person. I would love to be the one that helps patients to get better. I also like the flexibility of the job and the fact that I can travel from floor to floor and I don't have to have one set job. I can travel from state to state to different hospitals, or I can just find one set place that I like the most. My mom is a nurse, and hearing her stories interests me a lot, and it just makes me want to become a nurse even more. Nurses need to be empathetic, caring, and have good communication skills. Difficult patients come into the hospital or any type of job for nurses all the time, and I understand that treating difficult patients is so important. Just because they might be rude or difficult doesn't mean that they don't need treatment. Treating everyone the same way I would like to be treated is important to me, and I find it easy to deal with difficult people. It's also important to be quick on your feet and able to think critically in stressful situations. I keep my calm very well during stressful situations and find it easy to think quick on my feet. Paying attention to detail is a huge part of nursing because if you miss a step, overlook something, or give the wrong medication, it could be fatal to the patients. Rechecking your work is key, and I'll be able to do that very well. Nurses are the backbone of the healthcare system. They have vital roles in patient care, from emotional care to actual medical care. Nursing is evolving. This year alone, there are over 3 million jobs available. It's an overlooked job, and it's one of the most important medical careers. Nurses have huge responsibilities in the healthcare system, and I'm very excited to hopefully be a part of that.